Welcome to Transitioning to Medicare Part 2. Those of you that are attending this probably have heard Part 1, and that's where we talked about enrollment and getting on board with Medicare, and we talked about Part D. We're going to be focused a little differently today, but this, just so you know, I'm Lois Romeo from the SHIP office, and that is Local Help for Medicare. So it's no cost, it's confidential, it's unbiased. We are all trained counselors, and we have to take tests to make sure, we know what we're talking about. But you can set up, we work with you on education, one-on-one counseling. That is by appointment. You can call our office and set up an appointment. We can look at benefit program reviews. So that could be benefit program within Medicare, or even comparing it to other like retiree plans, that type of thing. We also can help you with application assistance. So if you want to look at financial assistance, we can help you with that type of thing, and looking at problems, obviously. It is available to all Carroll County residents. If you have friends who would like to take advantage of this program, there is an office in each county in Maryland, and this is just the phone numbers. You could pass them along to them. This is also nationwide program. So if you know somebody in another state and says, gee, I'd like to find that, they can go to medicare.gov and they will find the listings for, they put in their zip code, it'll tell them the closest SHIP office. So where are we going to focus tonight? We're going to focus on the gaps in Medicare, what Medigap coverage options are, other ways you can supplement Medicare, as including Medicare Advantage and health plans. We'll talk a little bit about the Medicare Savings Program, so financial assistance, and then we'll cover briefly healthcare fraud and abuse. So if you were on for Part 1, this is going to look familiar, but I'll just do a very high level on this again, which is original Medicare consists of Part A and B, deciding whether you want a supplement that can act as sort of a safety net to pick up the financial costs that are not covered by original Medicare, and then Part D. So A is inpatient hospital, you've been admitted. B is medical, so that's pretty much all else other than drugs. So it's everything from doctors to labs to x-rays to durable medical equipment, cancer treatments, dialysis, outpatient surgery. All that falls under Part B, which is why you hear about that a lot more. The Medigaps are designed to give you some help with the costs that are not covered. And then you would have to decide whether you need Part D prescription drug coverage as well. That's on the original Medicare side. You can be on the left or the right of this chart. If you pick a Medicare Advantage plan, under original Medicare, you can go to any doctor or facility that treats Medicare patients, which is most. Under the Medicare Advantage plans, you will have a network of doctors and facilities. And if you join an HMO, then if you go outside that network, you're going to pay all the costs. If you join a PPO, you will pay higher if you go outside that network, but you do have coverage. The Advantage plans will include a Part D in most cases, so you'll have that prescription drug coverage within the plan. And you have the option to get various things such as dental, vision, and hearing. If you're in a Medicare Advantage plan, you may not be sold a Medicare Supplement insurance or a Medigap. So what do your costs look like? If you're on the left-hand side of this chart, original Medicare, this is a view of the kinds of things you would pay out of pocket if you have no other coverage. So again, Part A, the standard premium is free for most people. If you or your spouse have worked for at least 40 quarters and paid into FICA, you will not pay a premium for Part A. If you are admitted to the hospital, not under observation, not in the emergency room, but if you're actually admitted to the hospital, you will be responsible for $1,556 before you have the other coverage. After that, there is a set of 60 days that you do not pay any coinsurance. So that's 60 hospital days. And if you happen to be in the hospital for more than 60 days in a benefit period, then you start paying a coinsurance up through 90 days. And then If for some reason you were actually more than 90 days within a benefit period, you pay a higher coinsurance, but you start working on what they call the lifetime reserve days. You get 60 of those in your lifetime. They can be used across multiple benefit periods. If you've been admitted to the hospital for at least 3 full days, and not the day you get discharged, but you then go to a skilled nursing facility, a rehab type center, then you will have 20 days of coverage with no coinsurance. And then after that, as you can see, you're going to pay $194.50 per day for the next up to 80 days. So all of this is tied to a benefit period. A benefit period is defined by when you last got out of either the hospital or the rehab center. If more than 60 calendar days have gone by, you will go into a new benefit period. The significance of that is that you will be responsible for the 1556 again, and your day count will start all over again. You're in a new benefit period, a new day count. So you've got that 60 days of coverage. So to make sure that's clear, if you went in and out of the hospital, say 10 days in January, February, and March, in each of those months, you would still be in the same benefit period. You'd be working on those 60 days of hospitalization. If you went in for 10 days in January and came out, and you didn't go back until April, you will have passed more than 60 calendar days since you got out, and you are in a new benefit period. It doesn't matter how many of those 60 days of hospitalization you've used. So you would, again, start with a new benefit period in that situation. These are some of the costs that you'll see, or why people pick up a Medigap if they can afford to. It's because you can hit those benefit periods more than once in a year. And as you can see, that could add up pretty quickly. Part B, on the other hand, is your medical insurance. So again, that's almost everything else except drugs. So it's including your doctors, your labs. It's the one you're going to use a lot more often for most people. And it can be payments like physical therapy or dialysis, that type of thing as well. For most people, they're going to pay $170.10 per month for their premium for Part B. And that's going to come right out of your Social Security if you are taking it. If you haven't started taking it yet, then you'll get a quarterly bill for 3 times that amount. That amount may be income adjusted, and I'll show you that at the end of the charts here. And that is, if you make more than certain amounts, you will pay more than the $170.10. There is a Part B deductible. And again, this all runs on an annual basis now. So the Part B deductible is the first $233 that you spend on doctors or labs. You're responsible for that, and there is no Medigap for most people that can pick that up. After that first $233, Medicare is going to pay 80%, and you, the beneficiary, will be responsible for 20% if you have not, if you don't have other coverage. If you go to a doctor or facility that does not accept assignment, there may be an additional 15% charge above what Medicare rate allows. So not accepting assignment just means they haven't agreed to the Medicare rate that's set for that procedure. So let me give you the example. If your bill from the doctor is $200 and the Medicare rate is $100, Medicare is going to pay $80. You're responsible for $20 if you go to someone who accepts assignment. If you go to someone who does not accept assignment, then you could be responsible for, Medicare is still only going to pay $80. You'd be responsible for the $20 if you have no other coverage, but you'd also be responsible for that other $15. Again, if you don't have coverage to take care of that. So what do your out-of-pocket costs look like with original Medicare? That really depends on, how often and the type of healthcare that you need. It depends on whether your doctors accept assignment, and that's something you can check with your doctors ahead of time to know whether they accept assignment. A great majority do. We run into it where they don't accept assignment in people like anesthesiologists in a hospital, sometimes where you have no choice as to whether they accept assignment or not. It also depends on whether you have other health insurance coverage. So you might have something that's picking up those co-insurances and deductibles. So one of the secondaries that's designed to do that is a Medigap policy. Again, you'll hear it called secondary, you'll hear it called Medicare Supplement insurance, you'll hear it called Medigap. These are all sold by private companies, and they're designed to fill in the financial gaps in original Medicare. So, the deductibles and the co-insurance. Your Medigap is only going to pick up the differential if Medicare has paid for the base procedure. If it's not something Medicare covers, your Medigap is not going to cover it. These are standardized plans, and all plans with the same letter have the same coverage. Only the costs are different. So determining whether a Medigap policy is right for you, it can give you a lower cost for your out-of-pocket costs. They do have a monthly premium, and that's sort of the trade-off you're going to make, is looking at paying a monthly premium versus paying any of those co-insurances should you incur them. They do only work with original Medicare, Part A and B. So again, it doesn't have anything to do with drugs. This is designed to help on the medical side of things. You may not need it though. If you already have an employer retiree plan, any kind of usually state government or county or city government or federal, then you're not necessarily going to need one of these because you've already got something that's a secondary that's picking up those differentials for you. These are the types of Medigap plans that you can pick up. If you go down the left-hand side of this chart, that is going to show you the things we looked at earlier that were your deductibles and co-insurances under original Medicare. If you go across that row and it has an X in it, then that plan type is going to pay that or a portion of it, as you see in some cases. If it's just a blank box, it means you're responsible for that cost. So if you look across these, just to make sure we're following the flow, if you look at a plan, Medigap plan type A, it is not going to pay the Part A deductible, the $1,556 if you go into the hospital. You'll notice all the others either pay all or some portion of that. Now let's talk about what people commonly pick. Some of the most commonly chosen plans are Plan G and Plan N. Plan G, you'll see, has an X in every box except the one that's blanked all the way across, which is that first $233 Part B deductible. Unless you were born before unless you turned 65 before January 1st of 2020, you cannot pick up a Medigap that will cover that $233. So if you were born before that and want to talk to us, you do have some other options, a Plan F and a F high deductible as well as a C. But for most of you now turning 65, or going on to Medicare for the first time, you're not eligible for those. So a Plan G is going to be your highest premium of the plans you can pick. But it's also, if you look down the X's, it's going to cover all those co-insurances and deductibles, except that Part B deductible, the $233 each year. So highest premium, highest coverage. A Plan N is probably the next most commonly chosen one. And if you look, we'll just talk about some of the differences. Just like G, it's not going to cover that $233. If you go to a doctor or emergency room, you'll pay up to $20 for a doctor. That's either primary or specialist, either one. And if you go to the emergency room and you're not admitted, you will pay up to $50. You also will not have coverage if you choose a doctor or facility that does not accept assignment. In that case, you're going to be responsible for that still. So that can be pretty attractive to some people. What might lean you towards a G versus an N is somebody who has dialysis regularly, 3 times a week, they're going to pay that $20 every time. And therefore, pretty quickly, that could add up to a lot more than what you're paying for a G that's going to cover all those. If you very rarely see doctors, or you don't end up in physical therapy on a regular basis each year, in those situations, then, an N might be very attractive to you. The other one that has gained popularity as more and more people have 401ks, if they've got assets that they could afford to pay some of those coinsurances and deductibles, then they might pick a G high deductible, and that's the asterisk. And if you look down below, you'll see it's the details about it are spelled out. Sorry. So in that situation, what's going to happen is you would actually pay the first 233, just like anyone else. You would also pay any other coinsurances and deductibles you incur up to $2,490 in 2022. After that, you're going to look like anybody having a standard G policy, which means you will have coverage on all the other coinsurances and deductibles. So in years, and this has a significantly lower premium than any of your other options on the Medigaps. So in a given year, unless you end up in hospitalizations, major surgery, things like that, you might incur a couple $100, but maybe not incur anywhere near the 2,490. But that's sort of a calculation you're going to want to do for yourself based on your frequency of seeing doctors, that kind of thing. So some people would rather pay the lower premium, put some money aside to handle when they do have to pay some of those coinsurances and deductibles, and manage that money more on their own. Others would just rather have, I want to pay that premium and I'm kind of done for the year. It's covering all those coinsurances and deductibles. So clearly, personal decision based on your type and use of the healthcare system. How are you going to go about finding the right Medigap policy for you? You can go either out to the Medicare.gov site, or you can go out to the Maryland Insurance Administration site. And the links are right here. It tells you how to get to them. The reason I would highly recommend the Maryland Insurance site is because that is going to give you the annual premium. So you'll know what you actually would pay for the supplemental policy. Whereas the Medicare.gov will tell you what's available in your given area. It's not going to have the annual premiums. So who's able to buy a Medigap? First off, you have to have Medicare Part A and B. These are individual policies. So spouses, unlike what you maybe had under your employer where it was a family kind of deal, you each have to pick up your own policy. There are some companies, and this is where you want to read the footnotes as we go through a book that I'm going to show you some pages, that do offer spousal or household discounts. So just make sure you read the footnotes. Medical underwriting is a concept that's important for you for when you're trying to pick out a Medigap. Medical underwriting is a process for them to review your health status and medical history. You do not do a medical underwriting during your open enrollment period. That's when you have something called guaranteed issue rights. When do you want to buy a Medigap? During your Medigap open enrollment period of guaranteed issue rights. And the reason being that during that guaranteed issue right period, they cannot ask you medical questions. You will come in at the same rate as everyone else, whether your health is terrible or excellent. And if you pick a policy, they have to give it to you. Your guaranteed issue right period can come in a couple of different flavors. It's going to be 6 months beginning when you are 65 or older and enrolled in Part B. Again, this is a big reason that people that are still actively employed, either they or their spouse, and covered by the employer coverage, don't pick up Part B when they turn 65. It's so that they protect that guaranteed issue right period, and also so they're not paying a Part B premium when they're not going to get a lot of benefit from it. If you are disabled and you're under 65 and you have Part B, so you've hit your 25th month and gone on to Medicare, then there's only two of the plans you can pick, Plan A or D, and they are going to be more expensive because they're the only plans available to folks with disabilities, and therefore they pay out a lot more claims. So, however, you do get a second open enrollment period for yourself, which is when you turn 65 and you're enrolled in Part B. So it's important if you have a disability and go on Medicare for that reason, or you know somebody that does, please make sure they know to come talk to us and we can help them on making sure that they take advantage of their 6-month open enrollment period tied to turning 65. They'll be able to get a much lower cost policy. So you can change Medicare policies after your Medigap open enrollment or your guaranteed issue right period. So unlike your Advantage plans and your drug plans, where you have to do your enrollment other than when you first come on board, you have to do your enrollment during open enrollment each year, then you actually can apply at any time for this, for the Medigap. They may require you to do a medical underwriting, and a couple things are true because of that. They may turn you down. They don't have to, just because you've picked them doesn't mean they will give you a policy. And secondly, you're likely to be charged more because of whatever medical conditions you have, whether that's just high blood pressure or whether it's more serious things. So if you decide down the line that, excuse me, that you want to do a new Medigap policy, then don't cancel your current policy until you know you have the new one. There are a couple other periods where you don't get 6 months, but that you can get 63 days of guaranteed issue rights. So if you have original Medicare and you have employer group health plan that pays after Medicare, so that would be small companies, normally under 20, and that plan is ending, then you get 63 days of guaranteed issue rights. If you have a Medicare Advantage plan that's ending, so in some cases we have Medicare Advantage plans that are no longer offered in our county. In that situation, you would have 63 days of guaranteed issue rights again to pick up a Medigap. If you've been on a Medigap and you decide you want to try Medicare Advantage for the first time you've ever done it, if you've been in that plan less than a year and you want to switch back, you have 63-day period where you can do that. And if you joined a Medicare Advantage plan when you first got on at age 65, and you want to go switch back to original Medicare within that first year, again, 63 days of guaranteed issue rights. The link below that's shown here on page 22 and 23, all of this is explained in more detail. So it's a little easier to follow probably. And that book I would highly recommend if you're looking at a Medigap policy, because it's everything we've talked about on the presentation is going to be explained in more detail in that book. And don't be alarmed if it says 2021 on it and 2022. They do not update that book every single year. So the other thing you'll find, and this will be talked about in multiple places, is Medigap policies have ratings. And those ratings are going to be issue age, attained age, or community rated. An issue age is going to be based on the age when it's purchased. So if a female buys it at 65 versus a female buys it at 75, the 75-year-old is always going to have a higher premium because they came in later. Premiums will can increase, but they're not going to increase because of age. They're going to increase because they got an across the board increase due to paying out more claims. It's not going to be because you got a year older. Attained age is the premium is going to go up automatically as you get older. For some, that's a 1-year cycle, some it's a 3, some it's a 5, but they will go up as you age. And again, we're going to show you examples of these. And then community rate, it says everyone pays the same premium for the same policy. It's actually split by men and women, non-smokers, that kind of thing. But there is not, it doesn't go the path the issue age or the attained age does. So most of this is a page from the book that gives you your monthly premiums for Medicare Supplement insurance. And this is from the Maryland Insurance Administration, publishes this book. It's also what you can look on online at the Maryland Insurance Administration site. So I want to just give you an example. In each of these, you will see normally the name of the company, how to get in touch with them on the left-hand side. We just blanked it out for this. On the right-hand side, you'll see where it says attained age. Almost all the policies issued in the state of Maryland are attained age. So let's look at female preferred. Preferred is what you would be getting if you go in under your guaranteed issue right period. If you go in and you bought a G at 65, you'll see on the chart that that would cost you $133 a month. When you're 65, by the time you get to 85, that's $228 a month. This company happens to offer also a high G and an N. So this gives you a little bit of comparison of those prices. So in this case, that high G is $52 a month versus $133, and goes up to $89 versus $228 a month by the time you reach 85. And again, then you'll see an N. So an N is lower cost than a G, but more expensive than a high G. And if you look at different companies, for instance, there's at least one company in the state of Maryland that offers a high G at like $33 a month to start with at 65. So they are going to be priced differently because it's based on the claims they've paid out. However, every G that's offered out here is going to give you exactly the same medical coverage. So even though you're going to see all different prices across the different companies, you're going to get exactly the same medical coverage. The N, remember, is giving you, you're going to pay some copay when you go to the doctors, and it's not covering your excess 15% if you go to someone who doesn't accept assignment. But you'll see that's $95 a month versus the G at $133, and it's $172 for this particular company by the time you get out to 85. So this just gives you an example of how your rates would change over the period of time as you age. This particular company, and it's Transamerica, and the reason I'll mention that is if you're looking through the book, it's the only one that has their policies all based on issue age. So in this situation, while you'll see different rates at different ages, what you'll notice is that as a female non-smoker, if I went in at 65, my rate is 162. However, if I went in at 70, my rate is 204. And then plus any across the board increases, obviously. So if you go in much later, like 85, you're at $330 a month on a Plan G. You'll also notice there is no G high deductible with this company. So again, each company can determine and decide which of the policies they want to offer. This is the only community rated company that's offered in the state of Maryland. It is AARP, United Healthcare, and you'll see they just split out between male non-smoker and female non-smoker, age 65 and older. So their policies for disabled are on a whole different table. You'll see again, they do not offer a G high deductible. But you'll see a base rate, which is what you would be charged if you go in your open enrollment period. The tier 1 and 2 rates on these particular charts tie to people who are coming in under where they do a medical underwriting. So depending on their health, they might get charged a tier 1 rate, they might get charged a tier 2 rate, but that doesn't apply in your personal open enrollment period. If you look at a G here, you're going to say, on a female, wow, that looks a lot higher. It's $226 for the base rate and $195 for an N. So you need to look at the footnotes. So if you enroll within those 6 months after turning 65, then you start falling into what they call their early enrollment discount program. So they're going to offer you a 39% discount off the rate you see there for ages 65 through 68. So again, this is where footnotes become very important. Once you apply that math, that's saying you're paying 61% of that rate, then it looks very competitive with some of the other companies. So the difference with the community rated is they end up offering you a discount up front. What they do after age 68 is they start taking 3% of that discount away each year, all the way up until you have no discount. You're then at that base rate at age 81. So after that, though, you will not increase because you got older. You're at that base rate, you stay there. The base rate can go up because of across the board rate increases, but you won't go up either because you got older or because they're changing anything on the discount at that point. You're at that base rate. Again, you'll see if you look at footnotes on some of these, some of those will give you a discount if more than one of you in a household has that company. So how much your Medigap's going to cost is going to depend on a number of things. It's going to depend on your age. It's going to depend on which company you pick to buy the policy from, the type of policy. That was where we were talking about the community rated or the attained age or the issue age. It's also going to can be determined by your health, but that's only if you're buying when you're not in a guaranteed issue right period. So the plan letter you choose is obviously going to affect the rate. So the annual premiums booklet lists the 2022 yearly premiums, which I find a little bit of a misnomer since they actually show you monthly rates, but you can calculate the annual premiums. But that's what the book is called. So some people will go out and look at this online, and there are links in what the library has set up for you to be able to do that. A lot of people prefer to actually look at the book. And if you want one of those, you can contact our office. We can mail it to you. You can come by the Bureau of Aging and we can hand you one. So whatever works best for you. So it is an important decision, whereas we tell you to look at both the drug plan and policy that you have each year, as well as the Medicare Advantage plan each year, because those run on an annual basis. This one, you kind of are making a lifetime decision, because again, you can change it later, but you don't have the same protections you have in your own personal open enrollment period. So do compare the companies and their costs. Look at the book and figure out what policy you think is going to be best for you. And then you contact the insurance company. You're going to complete an application and buy the Medigap policy. You can do that in one of multiple ways. You can go out to that particular plan's website. You can call the plan. A lot of people, particularly if they're in guaranteed issue right period, will just call the plan. And they will walk you through questions. You answer them. They either can do it for you electronically for a signature or mail it out to you and you sign it, send back a check, and then you have the policy. And as long as you keep paying your premium, you've got that policy. You can call us for detailed assistance. We're not going to do the enrollment into a Medigap plan for you, but we can certainly answer questions you might have about enrolling or making sure you understand the difference between the different types and all. So just quick rundown on original Medicare. If you pick a Medicare Supplement insurance policy and you can afford to do that, You can have a fairly defined flow, which is why so many of our citizens pick the left side of this chart. They know they're going to pay that Part B premium, the $170.10 a month. They know what they're going to pay for the Medigap. So that's going to be whatever that premium is. And or depending on the type they pick, they might pay certain co-insurances like under a Plan N. But again, they have a pretty good idea what they're going to spend. And then we can run the comparison for you each year, or you can do it yourself, the plan finder on Medicare.gov, and you know what you're going to spend that year for Part D. So for people on a fixed income, that Medigap acts as sort of that safety net to catch the different co-insurances and deductibles that you have to pay. So it makes it predictable. On the other hand, you might find that you look at it and feel that a Medicare Advantage plan is better for you. And we're going to spend some time now talking about that. Again, it's an HMO or a PPO, and you normally will have Part D included underneath it. And you can get some services that you don't have under original Medicare, such as vision, hearing, and dental. So if you choose a Medicare Advantage plan, however, you may not pick up a Medigap to act as that safety net on your costs. So what are Medicare Advantage or cost plans? They're just an alternative way of getting your Medicare benefits. They're still ruled by the Medicare conditions. You still are in the Medicare program and get all Part A and Part B services. Again, you cannot pick up a Medigap plan though. So how do Medicare Advantage and cost plans work? Well, first off, they are private companies, just like the Medigaps are. So you're going to find all different pricing. They work off a different model. They do a cost sharing. You're going to pay a monthly premium, just like you did with a Medigap, but you're going to pay a monthly premium and some co-payment and co-insurance for your services. One thing they do have, you don't have, if you do not have a Medigap over under original Medicare, there is no out-of-pocket limit of your spending on the medical side if you ended up going to the hospital multiple times, that kind of thing, right, in different benefit periods. On the Medicare Advantage plans, you do have an out-of-pocket limit that says if you've paid enough co-insurance and deductibles to hit that limit, then outside of your drugs, you're going to have full coverage. These do have geographic limits. So they normally will use a network of providers, and they have a geographic region that they support. They may require you to get a referral if you want to see a specialist. So Medicare Advantage cost plans, as I said before, you can get some extra services depending on the plan you pick and what they offer in a given area. And those would be things like vision, dental, and hearing. So if you have cataract surgery, that's covered under original Medicare. But if you just go to have your eyes checked, get a pair of glasses, etc., that's not covered under original Medicare. But some of your Medicare Advantage plans can have coverage for that. And normally, like I said, the drug coverage is included. So when are you able to enroll? You can enroll in a Medicare Advantage plan when you're first eligible for Medicare. You can look at it every single year during the annual enrollment period. So that's October 15th through December 7th of each year. There are some special enrollment periods. And then it is important to go ahead and review this every annual cycle. So during that October 15th through December 7th, we suggest you look at it every year because the plans can change. What you need from a plan can change. And that way you'll know you're doing the best coverage for the cost. So these are the Medicare Advantage plans that are offered in Carroll County in 2022. You'll see that quite a few of them are HMOs. As a reminder, if you're in an HMO and you go outside the network of doctors or facilities, you have no coverage. You pay all the costs. If you're in a PPO, you're going to pay higher out of network, but you have coverage. We'll talk about MSA separately because it's a little different than an HMO or a PPO. And then there are three at the bottom that are listed. The only folks that are eligible for those particular plans are folks who are Quimby beneficiaries or full benefit dual eligible. And that is essentially someone who is about the Medicaid level of financial. So these charts are charts that we create just to give you a high level overview. All of these Medicare Advantage plans you can compare out on the Medicare.gov site and see what they look like. And it'll give you, just like the plan finder for drugs gives you all the costs and all, you can look at the costs for these out on Medicare.gov under the plan finder. You just select that you want to look at Advantage plans. So we have enough different plans now that we separate HMOs from PPOs. And you'll see we only have 4 PPOs that are offered in the county, one of which does not have a drug plan. The only people typically, if you pick this, you may not pick up a Part D. So the only people typically that might choose an Advantage plan with no drug coverage is because they have some other form of creditable drug coverage. Might be through the VA, might be through some other sources. So I'm just going to walk you through a couple elements on here. You'll notice under monthly premium, we have H, D, and T. The reason we split that out is, number one, so that you understand the health portion of your coverage is costing you $36 a month. The drug portion is costing you $34 a month. So your total premium is going to be $70 if you're looking at the first one on the chart, the Humana Choice PPO. The reason we split that out is for those of you who might qualify for SPDAP, the Senior Prescription Drug Assistance Plan, it will pay up to $50 a month for you, but it's going to only pay that against the drug side. So if you go down to Johns Hopkins Advantage PPO, out of that $60.20, if you have SPDAP, it's going to pay $50 of that. So your total premium is not going to be $100. It's going to be $50. So that's why we split out the H and the D. So you'll see most of them do not have a deductible, but they do have a maximum amount of out of pocket. So after you pay co-insurances or deductibles that add up to the amount shown here, and again, outside of drugs, if you stayed totally in network, then, and for the Humana, had spent $7,550 out of pocket outside of your drugs, then you will have full coverage. It's going to pick up everything. If you've actually had some in and some out of network, you have to go to 10,000, or you'll see some of the others have a higher limit. Next, you see the outpatient and the inpatient costs. So some of them you'll notice have a set amount per visit. Some just say 50%, particularly on the out of network is where they're going to tend to say 50% or 30% or whatever you see in the box. If you're admitted to the hospital, so this is a little different model. Over under original Medicare, you paid $15.56 if you're admitted to the hospital. Under these plans, you're paying a set amount a day. So you'll see under Johns Hopkins Advantage, for instance, up through the first 6 days, if you're in the hospital, you're going to pay $330 each of those days. So that's going to add up to $1,900 and something. So it's going to be higher than the $15.56. But in that benefit period, then, you then have 90 days of coverage versus 60 days over under the original Medicare. Now, if you go to your doctor, you will see, if you look down the right-hand column, if you go to a primary care doctor, that's, depending on the plan you pick, going to cost you either nothing up through $20. Whereas if you go to a specialist, and these are all in-network pricing, you're going to pay anywhere from $40 to $50 per visit for a specialist. In each of these cases, if you go out of network, you're going to pay a percentage of whatever the cost is. So this is why it's very hard sometimes to compare what your costs look like under an Advantage plan versus under original Medicare, because it's all going to depend on the type of service you get and whether you're in or out of network and the plan you pick. This just gives you a flavor. Every medical facility needs to treat you in emergency or urgent care. There is no such thing as in or out of network in those situations. So as you can see, some of these have a flat rate. Some will say either or, depending on what it is that gets spent. Lab, you'll notice in some cases can be, depending on what you have done, can be no cost to you if you're in network, or they can be up to 50% out of network. On the other hand, if you go for an MRI, again, that can vary significantly, but in many cases, it's going to be the $250 range in network. So these are the HMOs. If you looked at the earlier chart, you will notice I do not have the Kaiser Permanente plans on here, the HMOs, and it's not because they're very well rated, etc. They're just not very convenient for most of us in Carroll County, because you have to go to Frederick, or you have to go to Glen Burnie, or you have to go, there's a lot of different sites you can go, but other than for urgent and emergency, you have to go to their sites to have any coverage because they're all HMOs. So the first couple on here are brand new this year, first time they've been offered in Carroll County. And you will see a variety of options. One thing you'll notice is there's quite a variation across the cost of the monthly premium. So that's where you want to make sure when you go out to the website at medicare.gov that you pull all the particulars up. You'll also notice that while there's a maximum out of pocket if you stay in network, there is none. It does not apply if you're out of network. And that's because out of network, you're going to pay everything, and there is no upper limit for that situation. Just like if you go over under inpatient hospital, if you go out of network, you're going to pay 100% of the cost. So it's important to know what's in and out of network on these, and which things about those are important to you personally. So again, this is just giving you a flavor for some of the different pricing. So you can tell it's not quite so straightforward as original Medicare. It's a different model. So what is a medical savings account? This looks more like what some people have used as an HSA when they were working. In this situation, what happens is you have a high deductible, but you have a medical savings account. So each year, if you look down below in the first of the two policies, there's a deposit actually put in that you can use towards medical expenses. So it's put into the bank, and you have either $2,000 or $3,000 put in. You can spend against that for any of the medical services, etc. And it's one of those situations where you can even do certain over-the-counter types of things in a drugstore. You could use this for that. You'll also see there's an annual deductible, either $5,000 or $8,000. The member is responsible if they've spent more than that annual deposit, the $2,000, they'd have to pick up the next $3,000 of expenditure. And then after that, they have full coverage for everything but drugs. I mean, the attractive part to some people is, number one, there is zero premium for these. Number two, they like the fact they get a deposit in there, and if they don't use it, it rolls over to the next year. So it doesn't go away if you don't use it within a year. Okay, you're still though going to pay both for, and I didn't highlight that again, but under all of the Advantage plans, including this is a cost plan, it's considered MSA, In all those situations, you're still going to pay your $170.10 for your Part B premium each month. This particular plan does not include the MSAs, do not include prescription drugs, but you are able to pick up a Part D prescription drug plan if you have an MSA. So the annual deposit is going to be put in for your use. As I said, it accumulates over a couple years. A nice thing that's important to know as well is that providers still have to go with the Medicare approved amount. They can't charge you more than that. However, there are a lot of people that would not be able to take advantage of an MSA. If you've got employee or union retiree plan benefits, TRICARE, VA, federal health benefits, hospice care, or eligible for Medicaid, you are not able to join one of these. So let's shift for just a moment. And you heard this a little bit last week, but I'll repeat it for you. Once you have your Medicare number, go ahead and get set up with a My Medicare account, or we can help you do it if you have difficulty with it. You do that out at the www.medicare.gov site. Once you've done that, there are a whole lot of things you can do there. One other piece of information, do not confuse it with the Social Security sign-in that you have. They are totally independent. Once you've enrolled, etc., other than IRMA and that kind of thing, and change of address, you're not going to deal with Social Security for your Medicare related things. You'll be dealing within the Medicare site now. And in that is where you would set up a My Medicare account. Once you do that, you're able to do a whole lot of things in there. You can manage your prescription drug list and other personal health information, which says you've got everything saved, and you can then run your drug comparisons for the next year, each year, to say, have I changed something? Let me update it. Let me find out what my lowest cost for the year is. You can also go out and see your Medicare summary notices. So any of you that have ever been exposed to someone receiving those in the mail, there are a lot of printouts in there. It's very voluminous. You can, however, look at it online if that's what you choose to do. It's totally your preference. You can set it up either way. You can even print out a replacement card if for some reason you lose your Medicare card. So if you come in to see us and you have not set up a My Medicare account, we're going to do that with you, because that's a way we can repetitively pull it up without having to re-enter everything. We just do updates at that point. This is a table you can certainly take a look at to see, some points of view across original Medicare and Medicare Advantage. Keep in mind, it's a national chart. So the options in a given area on Medicare Advantage may be more attractive than other areas. So particularly where you have a lot of seniors and the plans compete with each other more, such as Florida, you're going to have some really good Medicare Advantage plans. You may not have choices that look as attractive to you in Carroll County. We just have more limited choices. So how do you find out the information again for the Medigaps and the health plans? Maryland Insurance Administration, you can call or you can go to their website, and that's where you can look at the Medicare Supplement pricing. You can go to medicare.gov, which works very well for finding health and drug plans. And that would include your premiums on those sets of things. You can look at it for the Medigap policies in your area, but it's not going to include the pricing. You can come to us and we can walk you through it. We can run comparisons for you. We can enroll you on your Medicare Advantage plans or your Part Ds. You can also call Central Medicare and they can do that set of things for you. So this is really to help you try to understand if you qualify for an MSP. So that's a Medicare Savings Program. The first three rows are federal programs. So they're nationwide. You will have both an income limit and a asset test if you hope you to qualify for one of those. If you qualify for the first one, qualified Medicare beneficiary, QIMBY, then you're going to have coverage very similar to Medicaid. Your Part A and B premiums, your cost sharing, et cetera, are going to be paid for. If you make a bit more than that, but still meet the asset test, then you may qualify for SLIMB. That is not going to give you the broad coverage QIMBY does, but it will pay the Part B premium, and that's at $170.10 a month. If you qualify for either QIMBY or SLIMB, you automatically qualify for extra help. That's designed to help you not on the health side like QIMBY and SLIMB, but on the prescription drug side. So it can help pay your premiums and deductibles, et cetera. You'll notice that the income limit is higher, the asset limit is quite a bit higher than it is under the QIMBY or SLIMB. The one other one that is offered as a state program is the Senior Prescription Drug Assistance Program. We have a lot of people on that. And part of the reason we have a lot of people on that is because there is no asset test. As you will also see, the monthly income that you could be earning is significantly higher, about double of what you would receive, what you could compare to on the other plans. The advantage of the Speed app is that you can have $50 every month towards your drug premium. If your drug premium is $30, it's going to pay the $30. If it's $60, it's going to pay you $50 of that. Pay it $50 to the plan. That is per individual. So if your spouses that are qualified for this, you're going to each put an application in and each get up to $50 per month towards your premium. The other advantage of being on Speed app is you can change once during the year. So if you happen to be on a plan and you get a new expensive drug that's not on their formulary, you could actually change to a different plan during the year, which you can't normally do unless you have some type of financial assistance. QIMBY and SLIMB folks can change each quarter, actually. So now that we've talked about that coverage, let's talk briefly about Senior Medicare Patrol. It's really designed to get after and avoid fraud and abuse to the Medicare system. There are billions and tens of billions of dollars wasted each year through fraud and abuse. Lots of very creative people out there that we'd like them to be doing other things. So first off, protect yourself from that fraud and abuse. Treat your Medicare card and number just like you would a credit card. Don't leave it laying around different places or give it out to people. I mean, you get a phone call, that's not from Medicare. Medicare won't call you or visit you to sell anything. So if someone's trying to sell you something and they're asking for your Medicare number, you don't give it out to them. Just hang up. It's fraud. You really want to only give your Medicare number out to your practitioners, whoever is doing that service for you, and or to Central Medicare or ourselves if you call in, so that we can look up things for you. You do want to refer and review your Medicare summary notices. So that's what's going to tell you what services Medicare has paid for on your behalf. So if you see things you didn't receive, or you see something that's billed twice, or it's not something you recognize as having been ordered by your doctor, then you may have a situation of fraud and abuse. First thing you should do in that situation would be to call the provider. Sometimes this is simply a keying error, and that's all it takes to get it fixed. If that's not the situation, then you want to make sure you have your information on hand, and you can contact either Central Medicare or ourselves at the SHIP office, the S&P, as I said, as well. And this is going to be a free and confidential service, so we can help sort it through and figure out whether something needs to be investigated. Again, we're both the SHIP and the S&P offices for Carroll County. This is our phone number, so if you want to get in touch with us, and it should be in the links as well, 410-386-3800. And you can call us if you want to stop by and pick up any of the books we reference. You can call us to say you'd like us to send a recording of this out to you. Actually, if you've got this, you've already got the recording. Sorry about that. And it's local help for folks, and it's free to everyone. So please take advantage. Our biggest concern is people not being educated enough to select the right things up front when they go on to Medicare. These are the income-related Medicare adjustment amounts we talked about. And this is for 2022. You'll see it, you look at a different income level depending on whether you are an individual or file jointly. And this is based on your gross income. If you are 91,000 or less, or 182,000 or less, and have a joint return or an individual return, you're going to pay that $170.10. If you make more than that, you're going to pay the corresponding amount in the right-hand column. So you could pay up to $578.30 a month for your coverage. And again, even though it's looking at your joint income, this is per person. This is talking about on the monthly what you pay. You also will have, if you've got an adjustment, you're going to have a Part D adjustment as well. And in that situation, you're paying whatever the plan premium is for that particular plan, plus the amount you see in the right-hand column. So if you have questions, please feel free to reach out and call us at 410-386-3800, and we would be very happy to help you. Thanks for attending. We appreciate you coming, and we appreciate the library facilitating this for us.